So actually, we have been listening about this topic a number of years now, antioxidants in male infertility. Still, there are some gray areas and some practical points which I want to just point out today, so that we can give a better management of male infertility. Now, if you look at the world map and the percentage of infertility caused by the male factor, you find that the maximum is in the Middle East. 60 to 70% cases of infertility are attributed to the male. So possibly because of the consanguineous marriages over there, the chances of having translocation sector are more over there. So that is why possibly they have a higher incidence of male factor infertility. And in Asia, somehow they are shown around 37%, which may not be a true picture because many times the data is 50% around. So in a way, the male factor is 50% as a causative factor in the male factor in the cases of infertility. Now, there are various causes for the male factor infertility. One is the lifestyle, which is the foremost today, because see the new generations, they are having late nights, less number of sleep hours, and alcohol, smoking, the party drugs. All these things are contributing to the spermatogenesis. The genetic, hormonal like hypohypogonadism, varicocele in some percentage of patients, and systemic disease like diabetes, hypertension, and the medicines which are given to treat those can affect the spermatogenesis. But having said that, still, 50% of the patients, we do not really know what is the cause of infertility. So they fall into the category of idiopathic infertility. Now, there's a very nice slide by Dr. Ashok from Cleveland. If you see that what he has done is that they have found that how many infertile patients are there in WHO. In 2004, if they found that 186 million infertile couples were there at that time, and in those 50% were due to the purely female factor, 20% were purely due to the male factor, and 30% the combined male and the female factor. Now if we take this 30 and 20, so we find that 50% is due to the male factor infertility, and out of this say 186 million, half of them, that is 93%, that the 93 million are the male factors which are contributing to the infertility. Now, further, what he did was that he divided this 93 million into two categories. One was where the cause was known or there was unexplained causes, and they found that it was contributing 50%. So out of this 93, 46.5 million were having a known cause of infertility. And then another 50% we did not know, which is called idiopathic male factor infertility. The cause was not known. So what he tried to do was that he tried to find out the oxidative stress which is present in the known cases and the idiopathic cases. So what he found that in the known or unexplained causes, the 30 to 40% the males had a oxidative stress which was shown in the semen sample. They have a method of detecting that. I'll come to that later on. While in idiopathic or unknown causes, 80% of the males, they had a oxidative stress. So, and to this group, he named as a MOSI, that is male oxidative stress infertility. It a new entity which he defined and his group defined, and the treatment for them is different than from all other causes of infertility. So we have a huge chunk of patients, so in millions, who require antioxidant treatment. Now, this topic I'm going to discuss under 10 headings. First is, what are the reactive oxygen species? Are they always harmful? What is the effect of excessive reactive oxygen species on epidemiology? What is the cause of excessive ROS? What are the
Would you please,
antioxidants? Hello, madam, can you hear me? Hello, can you hear me, madam? Okay. So, what are the antioxidants? Do they really help in improving the immunology? Well, these are the questions which come to anybody's mind. And how long we should be giving them antioxidants? And with so many combinations available, can we suggest some fewer numbers which are the best antioxidants? Then can we do give anything other than these medicines to these couples or to these males? Or in the laboratory, can we do something to circumvent the deleterious effect of reactive oxygen species? So that means the embryologist also can help in treating this male factor infertility because of the oxidative stress. And finally, there will be few carry home messages. So first is the question is, what are the reactive oxygen species? We all know that oxygen is the most important molecule which is participating in many of the metabolic reactions in the body. And during this process, it may lose one electron. And because it loses electron, its metabolites which are produced are the hydroxyl anions, H2O2 and superoxide anion. These are very, very unstable, you know, reactive oxygen species. They want electron at any cost to make that set stable. So what they will do is, since they need the electron, they can um, take it from the biomolecules which are available nearby, like the cell components, the cell wall, the mitochondria, or the DNA. So once they remove the electron from the cell wall or the DNA or the mitochondria, it damages the cell. And sperm is also a cell in a body. Now, the antioxidants, what they do is they provide an extra electron to this unstable reactive oxygen species, which I had already mentioned, so that they don't steal the electron from the important uh, phospholipids of the cell wall or from the mitochondria or from the DNA. So nowadays we are talking about the DNA fragmentation test, sperm DNA fragmentation test, and because of that, since if the antioxidants are not there, so DNA damage would be there in the sperm chromosomes also. So this is how this unstable reactive oxygen species can be quenched with the extra electron from the antioxidants, so that they don't damage the cell wall, the mitochondria, or the DNA. Now, on the left side, what you see is an antioxidant which has got electrons, moving around in circle around it, and on the right side there is a uh, free radical or the oxidative stressed molecules which is having a one less electron, and it wants an electron. So one electron from the antioxidant jumps from its sphere to the free radical and quenches the thirst of that free radical, so that they do not damage the cells. So this chemically reactive unpaired electron plus electron donation would make a stable electron pair which will neutralize the free radical, so they do not damage the cell wall, the mitochondria, or the DNA. So broadly, the reactive oxygen species, they have been divided into four categories. One is a radical, that is hydroxyl ion, superoxide, nitric oxide, and peroxyl, etc. And then non-radical like ozone, singlet, oxygen, lipid peroxide, or hydrogen peroxide. And third one is the oxygen derivatives. Then there's a very interesting thing that even the reactive nitrogen species are also there, like nitrous oxide, peroxide, nitride, and nitroxyl ion, etc. These are the free nitrogen radicals and also are considered as a subclass of reactive oxygen species. So all these reactive oxygen species, they are very, very unstable. They want electron at any cost. If we do not have antioxidants, they will take it from nearby cells, cell walls, or the mitochondria, or from the DNA. So are they always harmful, this reactive oxygen species? Yes, most of the time they're harmful, but we do need some amount of reactive oxygen species. So there is a paradox. So oxygen is required to support life, but its reactive oxygen species metabolites modify cell functions and endanger the cell survival. The ROS basically are continuously inactivated by the body's mechanism, which are present there in the body naturally, to keep only small amount of necessary ROS to maintain the normal cell function. So as far as the sperm is concerned, what are the sperm functions? One is the capacitation. Now capacitation is very, very important because this is the unless a sperm is capacitated, it will not be able to separate the granulosa cells and make a contact with the zona pellucida. By capacitation, there is a active, aggressive movement of the sperm against the mid body. So lateral head displacement, what we call it, it is increased. So you see the semen sample before the preparation and after the preparation, you'll find that initially the sperms may be moving in one direction in a little orderly manner. And once they're capacitated, they move their head like a madman, left, right. Basically, they are trying to, separate the granulosa cells by this flapping movement on the left and right side, so that then other sperms can go inside. The next important activity is the acrosomal reaction because they have to make a hole in the zona pellucida. So acrosomal enzymes are required, and then the membrane fusion between the head of the sperm and the ulema is important. Then only the chromosomal contents of the head can go inside the cytoplasm of the oocyte. For this, some amount of reactive oxygen space is required. So what I mean to say is, if we give too much of antioxidants, you may, instead of being helping, you may be harming the patient if they don't require the antioxidants, because all these three functions which are important for fertilization may not happen, whether it is for IUI or IVF. However, in ICSI, we circumvent these three. So having said that, that means some amount of ROS is important. How it is, I told you. The next is, what is the effect of excessive ROS on semenology? So that means some amount is okay, but when it increases, what would it cause to the semen parameters? Now, normally there is the balance between the free radicals and the antioxidants. But whenever the reactive oxygen species increases, so there is an oxidative stress. Or if the antioxidants are depleted, then also it goes in favor of the more increase in the reactive oxygen species in the cell environment, that can affect the cell function as well as the morphology of the cells. So oxidative stress plays a vital role in pathophysiology of infertility and also in assisted fertility. In our IVF program also it would affect. Now, this how does the sperm gets oxidative stress? And if there are more immature abnormal sperms, or if there is a male accessory gland infection like prostate, seminal vesicle, or epididymis infections, or due to some drugs, the varicocele, the smoking, the pollution, the cancer. So all these things can cause a oxidative stress. But the last point I left it, to talk separately. That is the prolonged stasis of spermatozoa in the epididymis or in the transit. Now this is the problem of the new generation today, because they may not have adequate frequency of intercourse or masturbation. With the result, there is a prolonged stasis of spermatozoa in the epididymis, and this would increase the reactive oxygen species, causing oxidative stress. So whenever we are, taking the history, we should take the frequency of intercourse also, and in case if it is less, we should, educate them that okay, at least during the reproductive age group, they should have at least twice in a week, even if they are not planning for a pregnancy, and during the phases of time of ovulation, at least on an alternate day, they should have intercourse. So whenever there is an oxidative stress, there is a protein damage on the cell wall. Also, there is a lipid peroxidation, damaging the biomembrane of the cells. and also causing the DNA damage. So all these things, the cell wall and the biomembranes, also the mitochondrial membrane also, and the DNA damage would cause a sperm damage, causing the male factor infertility. Why are the sperms more susceptible to reactive oxygen species damage? This is a very, very important question because there are other cells in the body. Why the sperms are more, susceptible to ROS? Because firstly, their cell wall, the plasma membrane, is rich in unsaturated fats, and secondly, in the sperm, there's hardly any cytoplasm. And even if whatever little cytoplasm is there, it has got a very low level of scavenging antioxidant enzymes. So they get affected by oxidative stress much earlier than any other cell in the body. So, in the times to come, you may be, predicting a person likely to have a heart attack or having a liver damage or, the aging by just looking at the sperms. And if the semenology is bad, so that means this person is already having oxidative stress and it is affecting all the cells in the body. And since the spermatozoa are having very less cytoplasm, so they get affected first. So it can give an indication to start the treatment earlier in the males. So there will be another indication of doing a semen examination in times to come and assessing the ROS activity in the semen. So this oxidative stress mediated damage to the sperm membrane may account for a defective sperm function observed in high proportion of infertility patients. Oxidative stress affects the fluidity of the sperm plasma membrane. By fluidity, what we mean is that the sperms are moving in a three-dimensional manner. So with the result, the membrane can't be firm or a hard. It has to have a fluidity. It should be flexible. So oxidative stress can affect the fluidity of the sperm plasma membrane, causing the abnormal motility or a decreased motility, and also can affect the integrity of the DNA. All this put together may accelerate the decline in the sperm counts associated with the male infertility. So, in nutshell, this oxidative stress affects the cell membrane. So, it would affect the way the sperm is moving and causing, a defect in uh, the sperm capacitation, and the sperm mitochondrial membrane gets affected. So the energy powerhouses are getting affected. So motility may be reduced and the DNA fragmentation can happen, and which can have either fertilization failure or could be a cause of early abortion as well. So, what is the evidence that idiopathic male factor infertility could be because of ROS mediated effects? The studies done by various authors from India as well as by the many Dr. Sharma, K, and that sector is strong beings, Dr. Sharma and Dr. Agarwal from Cleveland. The studies demonstrated that 25 to 88% of non-selected infertile patients have a high levels of seminal ROS. So that means as low as 25% and as high as 80%, 88% in a non-selected group may have a high level of ROS in the semen sample. And infertile males generating high level of ROS have, have a 7 times less likelihood of initiating a pregnancy compared with those with a low level of ROS. So that means there's a high percentage of males have a increased ROS, and this ROS would decrease the chances of having a pregnancy. Now, this is another study by Dr. Agarwal, and you find he has compared the donor semen sample and the male factor infertility patients with the abnormal semen parameters or with all the semen parameters are abnormal. So what he found was that you just see the last line ROS. You find in the donors it is 0.98, while in the males with the normal parameters it was 1.7, and the patients were having all abnormal semen parameters, it was 2.43. So that means as the deformities or increase in the semen parameters, you'll find that the ROS activities increase. So even if the if it is high, would be a cause of infertility. So again, Dr. Ashok, he did study the patients having a normal immunology with high ROS, and he suggested that inclusion of ROS measurement as part of idiopathic infertility should be done, and treatment with antioxidant may be beneficial in such patients. So, and it can be used as an independent marker of male factor infertility. So even if the normal civil parameters are there, and if you have means to find the reactive oxygen species in that semen sample, so these patients would be benefited. You'll find that there are some cases you find the semen report is all right, the female is young, but when you do the IVF or the ICSI, the next day you find that the fertilization rate is less. So this is the group of patients where the reactive oxygen species, if was tested earlier, would have been found high and would have benefited by giving them antioxidants. Uh, it affects motility, oxidative stress, and oxidative damage were increased significantly in the spermatozoa with declined motility. Because I told you about the fluidity of the membrane, so that is affected. So the motility is affected, and antioxidant capacities in the spermatozoa and the seminal plasma was lower in males who had infertility or subfertility. So that means ROS was increased and antioxidant capacities were reduced as per this study again by Cow et al. The another, the study which compared patients having oligozoospermia or having acinozoospermia and with the normal semen parameters, what they found was there are three things which they have studied. One is the oxidative stress. For that, they have done the study of the melanodialdehyde, which is a marker of oxidative stress in nanomole per liter, and also TNF alpha and picogram per ml. They found that the patients with oligozoospermia and acinozoospermia, they had a higher level of MDA in comparison to the normal zoospermia patients, and the TNF alpha was also higher in the patients with the poor seminology in comparison to the normal ones. And what about their antioxidant capacity, which is made as a superoxide dismutase and glutathione peroxidase levels? And it was found that it was higher in the patients with the normal sperms, while it was lower in the patients of oligospermia and actinospermia. The trace elements did not differ much, like cadmium, magnesium, and selenium, but anti-sperm antibodies were higher in patients who are having oligozoospermia and actinozoospermia in comparison to the normozoospermia. So the question arises then, how do we measure this ROS? We know that ROS is a culprit. We also know that the patients of infertility would have a male factors would have a higher ROS in the semen. But is there any method to measure this ROS? Yes, there are three methods. One is the chemiluminescence assay, and next is a luminometer, and third is a direct method such as pulse radiolysis and electron spin resonance spectroscopy. However, we do not have this at present in India, but Dr. Ashok and team, they have made this machine, or this they propagate this machine, which is called MyoSys, and it's a complete, definitive, and rapid seminal oxidative stress measurement system. So what they do is they have one chip, and in that chip, they put a small drop of a semen sample, and it would travel to the reference cell, and then this is inserted into the machine uh, over here, like we do the way we do the blood test and for sugar, and within 2 minutes you will get the result. How much is the level of ROS activity in the semen sample? So if we have, because this is a costly and patented machine, so we do not have easy access to that. But if it becomes easily available, it will sort out many problems in treating the male factor infertility, because then we can quantify what is the level of ROS activity and accordingly treat these patients. So, So this would be recommended as a diagnostic system for male oxidative stress infertility. And since it's not available at present, what do we do? How do we, find that the patient is having ROS activity? So there are some surrogates, you can say signs by which we can make out, yeah, this semen sample is having a oxidative stress. So when repeatedly, if you do the semen examination and you find the patient is having poor sperm motility, or is having teratozoospermia, a high number of round cells, leukocytes in the semen sample, the culture reports are coming normal, or increased semen viscosity, the poor sperm membrane integrity, or on the Hoss test, when you find that you're doing the Hoss test and you find that the coiling of the tail doesn't happen, or there is a poor fertilization on routine IVF, or poor sperm motility after overnight incubation with the oocyte. What you can do is that when you take a patient, when you suspect that it's unexplained infertility, so one can do the sperm survival test before you do the IVF and see what is the motility after over 24 hours of incubation. And if you find there is a loss of motility or the sperms are died, so that means this sample was having a high ROS, and you can treat these patients with the ROS antioxidants, and then again repeat the sperm survival test. And if it is improved, then you do the IVF or ICSI. You find you'll get a better result. Especially in repeated failure patients, this will be a good method of finding the ROS is the cause of infertility, and the patient will be more convinced to take the antioxidants for a longer duration. Otherwise, males generally take for 10 days, 20 days, and they stop it. So this would be a very good method, which in third world countries or where this machine is not available, we can use that, the sperm survival test. And next is a poor blastocyst development in the absence of a clear female factor. There is neither advanced maternal age or poor ovarian reserve, and still you find there is a poor blastocyst conversion. So that means this male could be the cause of this failure in the blastocyst formation due to the increased oxidative stress to the sperms. So we know that ROS is affecting the sperms, and how do we, treat that? What are these antioxidants? Now there are some natural endogenous antioxidants which are present in our body because the body has a system of healing itself. So these are bilirubin, thiols, uric acid, coenzyme Q10, superoxide dismutase, catalase, and glutathione peroxidase. So these are naturally present, and they would quench the thirst of this reactive oxygen species by giving the electron. Then, well, when we take the food, there are some antioxidant present in our diet also, like vitamin C, vitamin E, beta carotene, carotenoids, and flavonoids. So we should encourage the patients to take amla, to take more citrus fruits, and also the carrots and all the colored fruits, so that they get more of flavonoids also. And especially this apple peeling, before eating should not be done, because the apple peel has got a high level of flavonoids, so they can take apple as such after washing rather than peeling out the peel of the apple. Then there are metal binding proteins which are present in the body, like albumin, ceruloplasmin, metallothioneins, transferrin, ferritin, myoglobin. So, under normal circumstances, these antioxidants which are present in the body or which you take orally, they are able to control the reactive oxygen species bad effects. But when the ROS activity increases, it may fail. So under those circumstances, we may have to give some supplements. There are various micronutrients which are associated with male infertility, and deficiency of these micronutrients may result in infertility. So what are these nutritional factors like L-carnitine, coenzyme Q10, zinc, arginine, vitamin B12, and the free radical scavengers like lycopene, vitamin C, vitamin E, glutathione, and selenium. So these are the one which we may have to supplement if the natural system of scavengers, they fail. So there's a very nice study in Indian Urological Association, Journal of Urology, they want antioxidants which can be given. So the evidence A is the coenzyme Q10. So that means a patient who the first thing it should come to your mind, to give the patient is the coenzyme Q10, and then is the level B evidence, which is the vitamin E, carnitine, and N-acetylcysteine. And the next is the level of evidence C, which is glutathione, vitamin C, selenium, zinc, folic acid, and lycopene. So in that order, you can add the antioxidants to these patients. But if you see the list, it looks very long how the patient is going to take so many medicines. So one has to be careful in selecting what is the best for the patient, and whatever preparation you are taking, the suggested daily dosages which are mentioned in this slide should be followed. If the levels of, if you're just giving 100 milligram of vitamin C or 200 less than 200 milligram vitamin E, and maybe 50 milligram of coenzyme Q10 will not work. So minimum of coenzyme Q10 is 300, which will be given to these patients twice a day. So whenever you have people coming to you, just see what is the composition, dose, and what is the cost, and based upon that you can select the best antioxidant, because it has to be taken for a long time. And there are some new antioxidants, which have been found, like melatonin, astaxanthin, vitamin D and B. Especially astaxanthin is supposed to be much better than even the vitamin E. So these antioxidants can also be considered while selecting the antioxidant for the meals. Having said that, if we give to these patients, will it help in improving? Is there any evidence that by giving these antioxidants, the semen reports would improve? Yes, it has been found that the sperm count, the motility, uh, motility is the first thing which gets improved. The patients, they have been divided into two groups, treated and untreated. The sperm count does not improve immediately as much, while the it's a motility which improves. So that means the cell membrane which gets first affected gets first corrected also. So and the morphology also improves, and the viability of these sperms as tested by acridine or urine test would also improve. Now, the Ross et al., they studied the sperm quality and the pregnancy rate, then the various parameters of the sperm, like motility, concentration, morphology, and sperm variability, the pregnancy rate, and oxidative stress. And the blue one is the number of case reports which favor that yes, it improves sperm quality and the pregnancy rate, and the three studies shows that no, it doesn't improve, while the motility 10 study shows that yes, improves. The motility 6 do not agree, and concentration is not affected much, because the 10 studies are showing no improvement, only 5 are showing any improvement in the concentration. And again, the morphology uh, may not be held by most of the studies, and only two studies shows the improvement. And other variables in sperms, they say 13 studies are in favor, while 3 are not in favor. The pregnancy rate does improve after giving antioxidant. 6 studies shows positive result, while 4 does not show any result. And if you study the oxidative stress in the semen, all the studies, the 7 studies are showing, yes, it improves the oxidative stress. So that means even if the oxidative stress is improved in all the patients, you still may not get all the parameters improved by the antioxidant. So one has to look for other reasons as well. So various antioxidants, the Ross et al. Again studied, and they found that vitamin E would improve the pregnancy rate to 21% versus no treatment, 0%. Zinc sulfate, 22% versus 4%, treated and non-treated group. Selenium, vitamin A, C, and E, 11% versus no pregnancy, and vitamin C and E. did not change any pregnancy rate. Carnitine improved the pregnancy rate, 13 versus 0%. L-carnitine and carnitine again 22 2%. L-carnitine and acetyl L-carnitine 20 and remained the same. Astaxanthin, which I was telling you, it's better antioxidant, in comparison to the vitamin E. 55% showed improvement in comparison to 11% with no treatment was given. So similarly, vitamin A, C, E, N-acetylcysteine and zinc combination showed 5% improvement in the pregnancy rate in comparison to no improvement without the treatment. And multivitamins also, would improve the uh, pregnancy rate. So the viable the pregnancy rate with this combination improved at 13 weeks, 38% versus 60% with the no treatment was given. So that means there are improvement after giving the antioxidant, which is variable depending upon which antioxidant we are using. So in comparison, what happens when you give combination? Possibly they have a supporting effect to each other. They give a better result than given singly. So, as far as the Cochrane review is concerned, and where the 48 RCTs were studied with more than 4,000 patients, and antioxidant effect on the semen parameter was studied, they showed that there's a significant improvement in the live birth rate and the clinical pregnancy rate in these patients. And also the Ross et al. They studied the 17 randomized trials, and they also found by giving antioxidants the statistically significant improvement in the semen parameters in 14 out of the 17 trials, and the pregnancy rate showed a significant improvement after antioxidant therapy. And use of oral antioxidants in fertile men may have a beneficial effect on the sperm quality and the pregnancy rates. Again, Grassoslow et al. This studied the impact of oral antioxidant made of the sperm oxidative stress and the DNA damage. So they found that when they gave antioxidant, there is a significant reduction in the oxidative stress or the DNA damage after treatment, and in 19 out of the 20 studies. And improvement in the sperm motility, particularly in the stenozoic sperm patient, was significantly observed. So that means where you are planning for IUI and motility is the concern. So that is a place where antioxidants would be a good choice to give them before you switch over to IVF or ICSI. Again, this study, this is et al. What they have done is that they come to the conclusion that further investigations with randomized controlled clinical trial is needed to confirm the safety and efficacy of antioxidant supplementation in the medical management and treatment of male infertility. So that means the final word is still not out, but yes, it improves. But we need to have a little more studies, because this recent Cochrane review determined that men taking antioxidant had a statistically significant increase in both live births and pregnancy rate. For those undergoing ART, the odd ratio that antioxidant use would improve the pregnancy rate was 4.18, with the 4.85 fold improvement in the live birth rate also noted. So, antioxidants and these nutrients do help, but still, how much and which patient, that also needs to be further studied. So, antioxidants, they increase the sperm concentration, they increase the motility, and also improves the morphology. So in May 22 last year, so there was another Cochrane review, which the authors conducted a review of 90 randomized controlled trials comparing 18 different antioxidants with the placebo. So no treatment or another antioxidant in total population of more than 10,000 fertile men. The age range of participant was 18 to 65, while in India, I think now the 55 would be the last. They were part of a couple who had been referred for infertility treatment, and some were undergoing fertility treatment. So this evidence is current to the February 2021. And again, The conclusion was that the further large, well-designed, randomized, placebo-controlled trials studying infertility men and reporting on pregnancy and live birth are still required to clarify the exact role of antioxidant. The problem is that whenever we are having infertility patients, it becomes very difficult to conduct such randomized control studies. You give half the patient's medicine, half you don't give the patient, because many patients would not like to come into such a trials. They would say, "Oh, you better give us," because they don't want to waste their time in our studies. So there's a big hurdle in conducting such studies. So antioxidant supplementation may be more beneficial, not in all patients, but with the specific causes of infertility such as varicocele, acinospermia, that means low sperm motility, or idiopathic infertility. And antioxidants might be less effective in cases where the male infertility is due to severe structural issues, that is some morphological issues, or when there is a genetic factor associated. Under those circumstances, it may not help the male factor in infertility improvement. And another interesting thing is seeing that when you give antioxidant to some males, there is a very good improvement, while some are not totally resistant to any improvement after giving the antioxidant. So there is a person to person variations as far as the effect of antioxidants is concerned. The next question is, how long should we give the antioxidant? What is the minimum and the maximum? So minimum of 3 months should be given, because we know that it is 70 plus days of spermatogenesis. So whatever we give today, effect will be seen after 70 days only. And maximum we should give it for 6 months. And after 6 months also, if there is no improvement, then we should stop it and think of the other treatments. And in case the patient can uh, you know is willing, maybe the donor insemination may be helpful to them. So there are many combinations which are available. So can we suggest best three out of that, so that the patient is not burdened by the cost. So vitamin E, C, and coenzyme Q10 are the ones which should be tried first, and then only, or L-carnitine we can add instead of vitamin E today, or astaxanthin instead of vitamin E and C. So astaxanthin, coenzyme Q10, carnitine, or vitamin E, vitamin C, and coenzyme Q10. So these, five or six are the antioxidants which are more beneficial, can be tried in the patients. Now, opinion is divided, because they are costly. So, versus the fruits, which are, also giving antioxidants. And only the antioxidants belonging to category A and B should be advised initially. And if normal, majority are against for use in IU and IVF. So that means if there is no excessive ROS, one should not give it, empirically, patients who are going for IU and IVF. If semen parameters are normal, we have to give it. There is no choice. Since most of the RCTs are pharma funded, and I told you there is a difficulty in conducting such studies, because males would not be part of such studies. So they seem to be a little biased also, and duration is also not clear as on today. How long? But definitely more than 70 days. Giving 1 week or 2 weeks or 3 weeks of antioxidants, we should not expect any result. Can we give anything other than the antioxidants to these patients? Yes, we can advise them stress-free lifestyle. They should go for yoga, they should go for meditation, and regular exercise, physical exercise. They should avoid tobacco, drugs, alcohol, and they should have a healthy diet with vitamin supplements, etc. And along with that, they should not keep the mobile and laptops near the genitalia, near the testicles, because this electromagnetic waves and the heat both can damage the sperms. So patients should be along with the antioxidant, and if they cannot afford that, at least these things they can afford, they should do that. So there are some natural foods also which are high in the antioxidants, and Indians, especially the North Indians, we are all fond of rajmas, tomatoes, and spinach. And this winter is there now. We get a lot of palak, so they can take it. Otherwise, dark chocolates, barley, berries, and broccoli can also be added to the food. all colorful fruits would help them to get antioxidants. And nuts and seeds are also good source of antioxidants and micronutrients. What about the ART lab? Can an embryologist do something to circumvent these deleterious effect of reactive oxygen species? Yes, they should not do repeated cycle of centrifugation while doing the semen preparation. And there are suggestions by Twig et al. That if we add antioxidants like vitamin E, C, cysteine, and taurine and hypotaurine to the culture media, we can improve the developmental ability of the embryos by reducing the effect of ROS. So in the times to come, we are going to get this type of culture media, which will help us, decreasing the effect of the active oxygen species and get better blastocyst conversion. How you prepare the semen sample also would help us. So if the semen sample is good and motility is good, the direct swim up technique can be used. So that means no centrifugation, because centrifugation itself increases the ROS. Like if you do the semen examination before and after the centrifugation, you will find there is a difference in the ROS. ROS is more after centrifugation. And the new techniques of sperm preparation like microfluidics also will decrease the ROS generation, and avoid using the frozen semen sample if possible, because freezing and thawing also increases the ROS activity. Though we are keeping the frozen semen sample as a standby in case due to situational and ejaculation is not able to give the semen sample on the day of our pickup, so we can use the frozen semen sample. But that does not mean if we can give the fresh sample on the day of ovum pickup, we should preferably take that one rather than the frozen semen sample. So finally, what is the carry home message? That to balance the overall semen quality, we know that there are internal sources of reactive oxygen species like the pus cells, the autogenous generation of ROS by the sperms, and then external sources of ROS species like industrial compounds, cigarette smoking, alcohol intake, exercise induced oxidative stress, and elevated temperatures in the testicles, because the tight undergarments and all those things would increase the temperature. So these can be circumvented by lifestyle modification. And if the person is having varicocele, the varicocele surgery and vitamin supplements, and also the the natural antioxidants which are produced, superoxide synthetase, catalase, and glutathione peroxidase, by having adequate rest. Because other side we had mentioned that too much of excessive exercise also would increase the oxidative stress. So 8 hours of sleep is very, very important. And non-enzymatic antioxidants like glutathione, vitamin C, and vitamin E, or other like astaxanthin, I told you, so they can be used to balance the oxidative stress and the antioxidant activity. So, how to treat these patients? There's an algorithm. Firstly, you should have a good basic semen examination. Nowadays, what is happening? The laboratories are giving all variable reports. They are not following the WHO criteria. They are not following the morphology criteria. So you get all wrong reports. So one should have a good semen report, and then, if it is possible, you can test the oxidative state by this machine. Otherwise, I told you the parameters. If they are normal, the mortalities are normal, viscosity is high, or the history of failure of fertilization or decrease the blastocyst conversion. So under those conditions, we should know that yes, this patient is having a oxidative stress. Now, this oxidative stress can be due to inflammation, which can be seen by looking at the pus cells, and or by doing the prostate examination. You may find tenderness over there, or there is a Maggie. Uh, so one should see for any infection in the genital tract, and these patients should be treated with antioxidant, antibiotics, and anti-inflammatory medicines, and again test for the oxidative stress levels. And if it is okay, depending upon other factors, they can be allowed natural IUI or the IVF. Now the next is that if the oxidative stress is increased, so we should stress upon the lifestyle changes like smoking, decrease in the weight, etc., and counsel for appropriate changes. And then again, once he has stopped smoking and has reduced weight, retest for the reactive oxygen species by this uh, technique. Or if the varicocele is there, the patient should be treated for varicocele, and after 3 months, again retest for the uh, number of or the amount of reactive oxygen species which are present. And in case all have been done, so the patients may still require antioxidant supplementation. And then after say 3 months of antioxidants, one can test for the reactive oxygen species, or by the seminology, you see the parameters which I mentioned earlier. If they got corrected, one can go ahead with IUI, IVFC, depending on all other parameters. So meticulous semen analysis in a standard laboratory is a must. First step in treating or investigating the male factor infertility. And the physical examination to rule out hydrocele, varicocele, and the rational investigations are required. Avoid non-evidence-based drugs for a long time. Antioxidants usually in the mild problems. If the patient is having very poor count, very poor motility, and also morphological normal, so giving antioxidants may not help, but you may start it. But imagine, don't give beyond 3 months. But if the woman age is more and you have to do the IVF early, then maybe too much of antioxidants and waiting for a long period will not benefit the couple. Antioxidants are not reliable in the severe problems. We can't keep on giving it for a long time. One can think of a donor sperm option, and IUI and ICSI results would depend on the overall assessment of the couple as such, not only the male factor, the female factor as well. And based upon that, we should plan the treatment both for the husband and the wife. Now, in India, we have a peculiar problem that the males would not like to participate in the management of the infertility. They just want to be an outsider and keep on blaming the woman. So many times you may give them some placebo. If you have to give a placebo to keep them in the circle, so it is better to give them antioxidants or sometimes because they don't have harm. But don't give too much of that. At least a minimal dose you give it so that he should know that he also is the cause of infertility. The blame of infertility does not fall only on the woman because we know how they suffer in the society. So should be considered as a part of holistic approach to treating the real male infertility. And there is no doubt that addressing underlying medical conditions and lifestyle factors is essential for treating the male factor infertility, having a increased reactive oxygen species. Thank you very much.